On this Saturday night, the rush to get AstraZeneca into arms. The shots set to expire.
With all the changes, it's difficult to manage.
And Health Canada's new protocol surrounding the vaccine. The rise of the variant in Britain, putting the UK's reopening plan in jeopardy. Accusations of a toxic culture at Canada's Royal Military College. Plus, the virtual visit. The future of telemedicine in Canada.
Global National with Robin Gill.
Good evening and thank you for joining us. Tens of thousands of vaccine doses have been given a new lease on life. Health Canada is extending the expiry date on about 45,000 doses of the AstraZeneca vaccine. They were set to expire on Monday, but they can now be used until Canada Day. That's good news in many parts of the country, including Ontario. As Mike Le Couteur explains, healthcare workers there have been rushing to get shots into arms to avoid any waste.
Cars lined up onto the street at this drive-through vaccination clinic near Kingston, Ontario. Staff hoping to hand out as many AstraZeneca doses as possible before they were expected to expire Monday.
I've never seen people so excited to get vaccines. They're very jovial, very, very happy.
Then, by midday, the doses that may have been otherwise wasted were given a new lease on life by Health Canada.
The vaccine indeed can extend for a month to July 1st, which I think is welcome news in terms of being able to make sure there's no wastage.
The Ontario Pharmacists Association knows the sudden change could lead to more questions about the vaccine and even vaccine hesitancy. But they point out people can also wait until the 12-week mark for their second dose. Now, something Ontarians don't seem to want to wait for is kids returning to school. The provincial science table is recommending a reopening of schools in regions where it's deemed safe.
If they are open, I'm totally willing to let them go back to school if they want.
Infectious disease experts point out kids aren't likely to transmit COVID-19 to adults, and the mental health impacts of not being in school are significant for students.
Not just to impact them during this short period, but also lifelong, and then their kids. To me, when you factor all these things, there's no question on what the right step is.
Friday, Montreal took a step towards a post-pandemic life. It was the first night in months that Quebecers didn't have a curfew. Businesses were busy. It clearly caused some to let their guard down, even Montreal's mayor. Valérie Plante was seen in a photo posted on social media breaking health guidelines because she was with 5 people who aren't from her household.
You know, rules are good for everybody, including the mayor. And so my message today is to say, I apologize for that, but I do want us to continue to follow the rules.
The rules that will also allow 2,500 fans inside the Bell Centre for the first time this year to watch the Canadians take on the Maple Leafs. A small step towards normalcy that we all crave. Mike Le Couteur, Global News, Ottawa.
To that disturbing discovery in BC, forensics experts will work to identify the suspected remains of more than 200 children buried on the site of a former residential school. Indigenous leaders from across the province have been meeting to decide what steps to take next. Global's Paul Johnson is following the story in Kamloops, BC tonight. Paul?
Robin, the next event that we're expecting here is a community meeting scheduled for Tuesday, where the First Nation is expected to share with its members more of what they know about this discovery and the plan going forward, which could very well entail a massive excavation effort to identify any remains that are there and try and return them to their communities of origin.
The Kamloops First Nation says it's now in the process of reaching out to bands and other First Nations throughout BC who have missing children whose bodies could be in the unmarked mass grave they think they found on the property of the old Kamloops Residential School.
Doesn't surprise me.
Onto Kamloops land nearby, Herna Garami says the shocking news squares with stories she's heard since moving here in the 1970s.
There's a child that dies for whatever reason, and so these were all the same. Just put them kind of hid them away.
The city of Kamloops, BC, now making international headlines as the focal point for Canada's history of forcing First Nations children to attend its residential schools. Now understood as a cruel and inhumane system for eradicating their language and culture.
2 people so far come up to me and told me about that.
Downtown Kamloops is where we met Alphonse Adams as the news was sinking in. A residential school survivor from the Lytton First Nation, he remembers playing sports at the Kamloops school. Just spend a few minutes with him if you want to know how raw these wounds still are.
The people that did that, yeah. Sometimes I cry. I try to hide my anger and everything else. I don't like crying in front of my children. They don't know exactly what I went through.
One question that a lot of people have been asking is, if we have a situation here with a very large number of unexplained deaths, what is the role of law enforcement in all of this? We're beginning to hear a bit more about that with both the BC Coroner's Service and the RCMP putting out statements acknowledging that they've received reports of what they think might be here, that they expect that they'll be participating in this, but they'll be following the lead of the First Nation. Robin?
A heartbreaking story. Paul Johnson in Kamloops, BC. Thanks, Paul. We continue our coverage of a Saskatchewan man convicted of sexual offenses against minors who appears to have been involved with a sports camp that has operated for decades. Global News has obtained a police report detailing allegations against the camp operator that came after the conviction. Despite the complaint, police in Saskatoon say they didn't have enough evidence to investigate, and the camp is once again preparing for its new season this summer. Nathaniel Dove reports.
Noelle was 16 when she says her boss told her she could stay the night.
If you finish late, I'll drive you home, or, we can just tell your mom that you can stay here and you can get up early and work tomorrow.
Another employee also accused the boss of misconduct in his home office. Global News has agreed to protect the identities of the 2 women.
He's like, you can't wear your duffel bag like that. I'm looking at your breasts. That makes me look at your breasts.
Both worked at a basketball camp 20 years ago for Dennis Robert Hall, a man convicted in 1981 of having sex with 2 girls between 14 and 16 years old and indecently assaulting 2 other adolescent girls. Several media outlets have previously reported Hall received a pardon in 1994. Both employees say they quit and that Hall continued phoning and emailing them. Sylvia went to the Saskatoon police in 2003.
The emails I would receive from him would say things like, you need help. You're a sick little girl. There's something wrong with you.
The police report, obtained by Global News, states Hall allegedly told her that she should have a baby and that he could help her with that. He reached over and rubbed her belly. Parts of the report are censored, but it also says there is nothing at this time that would lead us to pursue further investigation or have suspicions that charges may be able to be laid.
I felt even worse when I left, because I felt that it wasn't valid.
Around this time, Hall was quoted in a newspaper article saying he had changed after his conviction and he apologized to anyone who remains hurt. Hall did not respond to questions about the allegations from Global News. In a statement, Saskatoon police said they couldn't speak to the investigations, but added they would investigate if they get more information about the 2003 complaints or if additional complaints come forward. Meanwhile, an email from a camp account to a parent stated Hall hasn't been involved in years. No one from the camp responded to Global's inquiries, but photos on the website from 2011 to last year appear to show Hall was there.
This is a really complicated area.
Monique Saint-Germain is a lawyer for the Canadian Centre for Child Protection. She says the federal and provincial governments need to work together and that new rules are needed to keep offenders away from children.
We should, of course, be focusing on getting people to a place where they can go back into society and hold a job and be functioning. But there's nothing that says that a person needs to be working with children.
It's a warning this former camp employee has issued for years.
And I think he's a dangerous guy and he should not be around children.
Nathaniel Dove, Global News, Saskatoon.
Kingston's Royal Military College is Canada's West Point, the training ground for generations of this country's military officers. But some describe the RMC as a potential wellspring of toxic culture, one that has tolerated sexual misconduct in the Canadian Forces. Now, the former head of training at the RMC is speaking out, alleging attempts by his superiors to cover up incidents of sexual misconduct at the college. Our Ottawa Bureau Chief Mercedes Stevenson has the story and a look ahead to this week's edition of the West Block. Mercedes?
Robin, retired Lieutenant Colonel Mark Popov is a 27-year veteran of the Canadian Armed Forces. He led troops in combat in Afghanistan, but he says his posting to Kingston's Royal Military College was more stressful and painful than command in the violent Dan district of Afghanistan during the war. As Director of Cadets in 2014 and 2015 at RMC, Popov was responsible for training the college's 1,200 officer cadets. He says that what he saw in his time there devastated his faith in the military and left him fearing for the future of the armed forces. Popov says 2 former heads of RMC, who are now top-ranking generals, then Brigadier General Al Meinzinger and his successor, then Brigadier General Sean Friday, failed to take appropriate action in response to cases of sexual misconduct documented at RMC under their leadership. Meinzinger is now the head of the Royal Canadian Air Force, and Friday is serving at U.S. Central Command headquarters in Tampa, Florida. Popov says Meinzinger and Friday failed to order fulsome investigations into cases of sexual misconduct and to punish the alleged perpetrators. Popov revealed to Global News disturbing allegations of sexual harassment, sexual misconduct, and a lack of proper care for victims of sexual assault. Popov says he worries about the message that sent to officer cadets over the years, a perversion of the RMC motto, truth, duty, valor, to what Popov describes as truth, duty, valor, don't get caught.
This tells the perpetrators who've gotten away with it that they can get away with it, that they will be protected, that the senior leadership is not interested in pursuing it. It enables this kind of conduct of those who would be perpetrators. And for those who would be victims, it says, what you say doesn't matter because no action will be taken. It's all talk, no action.
Both Meinzinger and Friday reject Popov's claim they failed to respond properly to sexual misconduct under their watch at RMC. And the Department of National Defense is standing by both generals. In a statement, the department said, quote, all alleged incidences of sexual misconduct were acted upon appropriately and in accordance with applicable DND/CAF policies, including immediate support to any victims. Also on the show this week, I'll be speaking with Acting Chief of the Defense Staff, Lieutenant General Wayne Eyre, on his views on RMC and what comes next for the military in its efforts to stamp out sexual misconduct. Robin?
Mercedes Stevenson in Ottawa. Thanks, Mercedes. And you can watch the West Block tomorrow right here on Global. Coming up, Americans on the move for Memorial Day weekend, desperate for travel that still isn't normal. It's Memorial Day weekend in the United States, the unofficial start of summer, and Americans are on the move. Airports and highways are packed, and that's starkly different from the holiday weekend last year. More than half of the adult population in the U.S. is fully vaccinated, but health experts are warning people they still need to be careful. Jennifer Johnson explains.
South Carolina's Myrtle Beach is packed as Americans welcome in the first unofficial weekend of summer. The American Automobile Association predicts close to 40 million Americans are traveling this Memorial Day weekend, a 60% increase from last year when COVID-19 had a stranglehold on much of the country.
As more people get vaccinated, they're becoming more comfortable with the idea of travel, but there's still some travel hesitancy.
Despite higher gas prices, highways are clogged and many airports are crowded. Americans are desperate to return to normal.
It was a long time coming and it is about time.
But doctors are warning people, especially those not immunized, to keep their distance and avoid large gatherings.
I am very concerned about people who are not vaccinated, who think that because the rates are down, they're off the hook. They're wrong. They could very well get sick. They could very well end up in the hospital. They could die.
The Biden administration says it's on track to getting 70% of U.S. adults fully vaccinated by the July 4th holiday. And some state health officials are going the extra mile. This mobile vaccination clinic is set up at a New York beach.
Bringing the vaccine to people
is what's going to get us to where we need to be.
So convenient and too tempting for some to pass up.
I said, it must be meant to be. Let me go get a shot.
U.S. Airlines, which lost $35 billion in 2020, are celebrating the return to travel. 1.5 million passengers are expected to pass through Atlanta, the nation's busiest airport this weekend, the biggest crowd since December 2019. Restaurant owners are also predicting big business.
It's going to be crazy. People have been dying to get out.
Most states have lifted mask and social distancing requirements just in time for the holiday weekend, desperate to welcome in patrons and tourists and their money. Jennifer Johnson, Global News, Washington.
Still ahead, the new COVID surge in the UK and the warnings for Canada.
You're watching Global National.
It was a terrifying scene just minutes into a ferry trip in Indonesia. Close to 200 people were on board when the ferry caught fire. All the passengers and crew were forced to jump ship. Fortunately, fishing boats in the area helped take the survivors to a nearby remote island. All 181 passengers and 14 crew members are safe, but it's still not clear what started the fire. Vietnam says it has detected a new COVID-19 variant that's a hybrid of strains first found in India and Britain. Scientists discovered it while examining the genetic makeup of the virus that recently infected some patients. Lab tests suggest this hybrid may spread more easily by air than other variants, and that it could be responsible for Vietnam's surge in cases. The country initially had success battling the virus, but in recent weeks it has recorded more than 3,500 new cases. The variant, first detected in India, is rapidly spreading across Britain. It is now the dominant strain in the UK. The country has reported its highest level of infections in almost 2 months. And as Redmond Shannon explains, there's concern the variant could delay the country's final stage of reopening.
Come through. Thank you. Round to the right-hand side, sir. Excellent.
England is nearly there. In 3 weeks, the last restrictions are set to be lifted. But the British government says a slow rise in COVID-19 cases again threatens that goal. It's partly down to the B1617.2 or India variant, which is believed to be more transmissible, although not necessarily more deadly.
The latest estimates are that more than half, and potentially as many as 3/4 of all new cases are now of this variant.
The new dominance of the variant, coming just after indoor dining and drinking resumed, makes it difficult to know what is driving the rise.
But I want to stress that we always did expect to see an increase in cases. That was always going to happen.
Variant cases are clustered in a few cities, and the highest COVID infection rates are among unvaccinated young people.
Last week there was a week when 1% of Bolton's 10 to 14-year-olds tested positive. I mean, that's incredibly high. We know from Public Health England that attack rate, so the chance of you being affected if you're a contact from someone with the Indian variant, is over 50% higher than if it was a contact with the old Kent variant.
Research suggests a second vaccine dose is crucial against this variant. According to official figures, it currently makes up just a tiny fraction of cases in Canada.
I wouldn't be surprised in the months to come that we definitely start to see a rise in the B1617.2 variant.
If that happens, provinces will be racing to get not just 1 but 2 doses into Canadian arms. But only focusing on Canadians will be short-sighted, according to global public health expert Ananya Banerjee.
We are on the verge of a vaccine apartheid, and that we need to make sure at least 10% of each country globally are vaccinated, particularly seniors and healthcare workers.
She says unless richer nations ensure that happens, other variants will appear, one of which might even evade vaccines and put us all back to square one. Redmond Shannon, Global News, London.
Up next, virtual healthcare may be just what the doctor ordered. The pandemic has changed the way we do many things, including how we see a doctor. Consultations over the phone and virtual visits have become the norm, and experts say they may be here to stay. As Jamie Maracher explains, telemedicine could save the medical industry billions of dollars.
Just as COVID-19 began to creep into Canada, Dr. Daisy Singla launched a telemedicine-based therapy project.
Right. We're focusing on women who are pregnant and postpartum with depressive and anxiety symptoms.
And how would you say that makes you feel?
Currently, the system is being accessed by more than 1,300 patients working with 40 providers across North America.
Their ability to adapt to delivering this psychotherapy via telemedicine has been incredible.
According to a new study by UK-based Juniper Research, teleconsultations are expected to more than double over the next 4 years to an estimated 765 million visits around the world in 2025. That trend could save the healthcare industry billions, with a virtual visit costing around $39 Canadian per patient, compared to over $110 for in-person meetings. For first-time parents Grace Poon and Jeff Britton, prenatal care during the pandemic doesn't allow for partners to be present.
All the pressure was on her for all these in-person ones.
Telemedicine, Poon says, has changed that and is excited to have a virtual option for when baby arrives.
Moving around with a baby would actually be a lot more work. So if it can just be a checkup, I would actually prefer telehealth.
But Poon cautions a phone call won't always cut it, a point shared by Humber River Emergency Room Chief Dr. Leon Rivlin.
There are very important conditions like abdominal pain, chest pain, shortness of breath, where a physical examination is absolutely essential.
Back at Mount Sinai, Dr. Singla says there are still plenty of benefits to telemedicine.
This is an opportunity to improve access to evidence-based care.
And with a retention rate of 90% for her program, she has little doubt this is the future of Canada's healthcare systems. Jamie Maracher, Global News, Toronto.
And that is Global National for this Saturday night. I'm Robin Gill. Tonight, Your Canada is Harrison Hot Springs in British Columbia. We'd love to see you're part of this country, so please keep sending your photos to viewers@globalnational.com. Thank you for watching, and I'll see you back here tomorrow. Have a great night.